Now we're going to talk about the medicines which are approved by the FDA and they are currently in the use for the treatment of, for the management of obesity. Now, the first of the medicine which I'm going to talk about is the medicine which has been in the market for quite some time, the Zenical or Orlistat, and its newer version, the Cetilostat. Now, the medicine actually, both of these medicines, they act by inhibiting the enzyme pancreatic lipase. The pancreatic lipase is the enzyme that breaks down the fats inside the intestine and gets it absorbed. So, by inhibiting these enzymes, they cause the fat to be excreted from the gut without being absorbed, and they cause a moderate loss of weight. About 4.5 kg weight is lost by these medicines. But the problem with Zenical was that it caused leaking of the fats, and in a leaking, and also it caused the side effect of diarrhea. So the newer medicine, which is called Cetilostat, does not have these side effects. It is more tolerable and it is being used more. The other thing is that Zenical is sometimes associated with acute liver complications, which is not the case with Cetilostat. Now I'm going to talk about the two medicines which are not exactly the weight loss medicines. These are diabetes medicines, but they are very effective. First of these is the metformin. Metformin interferes with the absorption of glucose from the gut as well as the glucose from the glycogenolysis from the liver. And this is only one of the few medicines in the treatment of diabetes which has been shown to decrease the mortality. And there are some people who use it solely for the purpose of prolonging their life. It is like a fad now to use metformin to prolong life. And this medicine is also used in the treatment of polycystic ovaries and insulin resistance syndrome, and it does lead to some weight loss in the patient. The other medicine which is used for the treatment of diabetes, again sodium glucose co-transporter mechanism inhibitor medicines like the dapagliflozin, like Foxiga, and there are other medicines also. Basically, they cause a loss of about 20 grams of sugars in a day by the loss of this sugar in the urine, and a moderate loss of weight is also accompanied by the use of these medicines. There's a combination of metformin with the Foxiga duo that is being used, which causes the loss of weight in a mild to moderate form, but basic effect is for the different reason. Now I'm coming to another medicine which is a good combination, Qsemia. It's a combination of phentermine and topiramate. As you know, phentermine was used in combination with fenfluramine in the fen, which became very notorious, taken out of the market. But all the side effects were related to the fenfluramine part of it, the valvular lesion, the pulmonary hypertension. Phentermine as such was not associated with these side effects. So these anorexigenic medicine, which suppresses the appetite, was combined with the topiramate, and this combination of topiramate, which acts the central glutamate receptor and suppresses the appetite, was used for the treatment of this weight suppression. Now, this combination of phentermine and topiramate can lead to the around about 10% weight loss of the body, but there are certain side effects of this medication, especially the topiramate. Some patients are not able to tolerate the topiramate, and it can cause insomnia, so it cannot be taken at night. It is usually taken at the daytime. It can cause certain dizziness and other side effects when some patients are intolerant to it, but for the patients who can tolerate this medicine, it is good. It can lead to 10% of the weight loss. The other thing is you cannot stop this medication abruptly, this Qsemia, the combination of phentermine and topiramate. You have to gradually stop this medicine, and there is a schedule also for the cessation of this treatment. Now, this is another medication which has come into the market, and it's pretty much patients are using it. It's a combination of bupropion and naltrexone, and this combination has anorexigenic effect, suppresses the appetite, and I have seen patients who come to me, but the effects are mild to moderate. Actually, a patient came to me who said she's using Contrav and she had gained 2 kilograms of weight. I don't know how compliant she was with the medication and how much she was with the diet. But as compared to the other regular medications, which can cause about 10% weight loss, the Contrav usually causes about 5% weight loss in this medication. Again, this is a combination of bupropion. Patient with epilepsy cannot take it. This has to be detailed neurological history of the patient has to be taken before starting such medications. As I said, this is the combination of the bupropion and naltrexone. As you can see, the bupropion mainly acts on the reward system of the brain, the hypothalamus, where the dopamine is released as a reward to the food, and it causes food cravings. And this bupropion suppresses this center, and this is why we don't get food cravings when you use bupropion. So it can be a combination with other medicines. Someone has to formulate a special formula for every patient individually. These things cannot be taken on their own. Now I'm going to talk about the Gelesis. Gelesis 100, it is sold under the name of Planety. Actually, it is being patented as a device rather than a medication. So it is basically a soluble cellulose. When you take this fiber, it gets in your gut, and then it takes the water and it forms a hydrogel which fills your stomach and your intestine and distends it, and you get a feeling of satiety and fullness, and you don't feel any hunger. So there are but certain side effects because of this. This whole filling of this intestine can cause some people to have diarrhea or constipation, malabsorption, cholestasis. That's why it's contraindicated in pregnancy anyway. Now, there are two groups of people who respond to this device or medicine. There is the one group which can lose 10%. These are called responders. 10% of the body weight can be lost just by using this device. I mean, you swallow a capsule, there's no absorption of the food, you don't feel any hunger until these things get digested and or excreted from the body, broken down and excreted from the body. And then the other group is the non-responders who have got less than 1% of their weight loss by the use of this medication. These are some pictures. They have shown how they prepare this Gelesis, and then it's the powdered form, and then this is absorbed, and then the help with the combination of this this powder with the water, you make a gel, and it interferes with the absorption. This is another picture showing the mechanism of action of this soluble cellulose soluble fiber and how it interferes with the absorption and helps in weight loss. Now we're going to talk about the semaglutide. Semaglutide is available in two forms. One is the injectable form, subcutaneous injection, which is called Ozempic, and the other one is the oral form, which is called Rybelsus. Now, these are the glucagon-like peptide 1 receptor agonists. This is the place where the incretin acts. The incretin acts on these receptors and it suppresses the appetite. Ozempic also acts on the same receptor, which is called the GLP-1 receptor, glucagon-like substance, like peptide 1 receptor inhibitor. Now, when incretin acts on that receptor, it suppresses the appetite. Same way, Ozempic or the Rybelsus, when they act on these receptors, they suppress the appetite. Now, and also they control the sugar level, they inhibit the glucagon secretion, they inhibit the release of glucose from the liver, they sensitize the pancreas, they increase the beta islet cell longevity. Anyway, now in March 2021, phase 3 randomized double-blind trial in which 1,961 adults with a body mass index of 30 or greater were assigned in a 2-to-1 ratio to treatment with once weekly subcutaneous injection of semaglutide or placebo plus lifestyle intervention. The trials occurred at 129 sites in 16 countries in Asia, Europe, North America, and South America. The mean percentage of the change in body weight at week 68 was minus 14.9% in the semaglutide group versus minus 2.4% with the placebo, with an estimated treatment difference of minus 12.4 percentage points. Ozempic leads to the 12.5% significant weight reduction in the form of a subcutaneous injection once weekly, as compared to the Rybelsus, which is used in oral preparation, which causes a loss of about 6.5 or 6 to 6.5 kilogram of the weight. Now we are going to talk about the Mounjaro, which is the latest medication for the treatment of the diabetes and also for the weight loss. And it acts on two receptors instead of one receptor. The Ozempic acts on the GLP receptor, GLP-1 receptor only, whereas the Mounjaro acts on GIP and GLP-1 receptor, both of them. So hence its effect is more. As you can see, these studies that there was a weight loss of maximum up to 19.5% with the 10 milligram dose and minus 20.9% with the 15 milligram dose. So almost the optimal effect was with the 10 milligram dosage, and it, as compared to the 12.5% loss with the Ozempic, this actually causes a 20 to 21% weight loss with the drug Mounjaro. Now we're going to talk about the newer molecule, which is actually a triple receptor agonist, and it is called retatrutide. It is being produced by Lilly, and it acts like on the glucagon-like peptide GLP-1, glucose-dependent insulinotropic polypeptide GIP, and glucagon receptor itself. And at a 48 weeks trial, there was 22.8% reduction in the weight in the 4 milligram group and 24.2% in the 12 milligram group. And it is even stronger than the Mounjaro. It goes even beyond the Mounjaro. And the other thing which is very surprising, that once the patients, experimental patients who took the retatrutide, who had this fatty liver disease, within the first week, this fatty liver was just wiped out. All the fat was gone from the liver. So I think it is it is going to be not only good for diabetes but also weight loss and also for the fatty liver. It says 58 pounds. That's how much weight patient lost on average at the end of 48 weeks when taking Eli Lilly's next generation obesity treatment. It equals to mean 24% reduction in participants' body weight, as I said to you earlier. So this is going to be the new medicine which is going to take the market, especially its effect on diabetes, its effect on weight, and its effect on the fatty liver. And we don't have such great treatments for fatty liver right at the moment. Now we are going to talk about the newer medication, another one which is coming in the market soon, which is called tesofensine. Tesofensine is actually a serotonin, noradrenaline, dopamine reuptake inhibitor. It was shown that the weight loss was 4.5%, 9.2%, and 10.6% in the 0.25, 0.5, and 1 milligram dose groups. And its safety profile is just like the other medicines. So I think it will soon be marketed for the weight loss in the market. Actually, it was initially marketed for Parkinsonism. I'm going to talk about combination of semaglutide with cagrilintide. Cagrilintide. Now I'm going to talk about the combination of semaglutide with cagrilintide. This is going in the phase 2 trials, and these phase 2 trials have shown its comparison, head-to-head comparison with Ozempic as well as Mounjaro. And basically what this medicine is, it is a combination of Ozempic along with the amylin, which is being given the name of cagrilintide. This combination, because amylin, when it is released from the beta islet cell along with insulin in response to glucose, causes the suppression of appetite by its central actions. So the action of incretin and amylin both combined together are being promoted as the next generation of the weight control medicines and appetite suppressants. And there is a phase 2 trial. I'm going to read to you about this trial. In a phase 2 trial, weight loss averaged minus 15.6% after 32 weeks, making cagrisema, the name of this medicine is cagrisema, comparable in efficacy to tirzepatide. A further trial sponsored by Novo Nordisk is comparing tirzepatide with cagrisema head-to-head. As of 2023, cagrisema is in a phase 3 trial. Preliminary trial results found a greater weight loss compared to either medication alone. HbA1c was significantly improved compared to the cagrilintide alone, or non-significantly better than semaglutide alone. So basically, this cagrilintide is a long-acting analog of amylin, and this medicine is also coming in the market. So we'll have some new products in the market soon, which may lead to, as I said, 50 to 60 kilograms of weight loss in the future. Thank you very much.